This is the Controlling Your Business Health Insurance Costs webinar, and so welcome. We're going to go ahead and get started with the presentation. Just to give you a little background about myself, I've been in the health insurance industry since 2001, and obviously since that time, a lot has changed. The cost of health insurance coverage has changed a lot. Once heard somebody say that if food had gone up as much as health insurance, a carton of eggs would be about $80. So definitely we're in a different environment now, and so we have to think more creatively on how to control our health insurance costs as business owners. I remember when there used to be very predictable HMO plans, low copays, low out-of-pocket expenses. Then the market sort of shifted to PPOs, and now there's a very big focus on consumer-driven health plans and HSA plans. And as you know, the Affordable Care Act has drastically changed the environment. Since 2014, there's been a rising interest in private health insurance exchanges, and in 2014 we saw the public exchange get started. So we've seen a number of people flock towards private exchanges, and I'm excited to be able to share that with you today about how that's one way of controlling your health insurance costs. Currently on our private exchange we have over 15,000 members. So the presentation is going to be geared around the private exchange, really the top 10 reasons why you should consider a private exchange in helping reduce the cost of your health insurance. So hopefully you'll see through the top 10 reasons why it's important and how it can help you reduce your costs. We work with a number of associations. You can see on the screen here we've got the Florida Bar, State Bar of Texas, State Bar of Georgia, FICPA, the Florida Medical Association, and the Missouri Bar, as well as some other smaller exchanges, some smaller associations. At a recent meeting, I heard one of the executives with Aetna say that in the next 2 years, they predict that over 30% of small employers will move to a private exchange. They simply cannot absorb the double-digit rate increases. I was meeting with a small 20-person law firm the other day. They had already considered just dropping their health insurance coverage completely and giving their employees money. And I'm sure many of you guys have had the same thought. So again, hopefully this will help you guys have another option so that you can reduce your costs, but also promote employee satisfaction as well, still through an employer-sponsored plan. I do want to let you know as well that there's a little box on the side of your screen if you want to ask questions. I will answer them at the end of the presentation, so just go ahead as you feel appropriate, just type in your questions, and then we'll have some time at the end. So the first reason to consider a private exchange is the choices, one of the most important benefits that it offers. You can choose between multiple different insurance carriers and multiple different plan options. So, for example, one employee may say, I want a predictable health insurance cost with low out-of-pocket expenses, and I'm willing to pay more upfront premium. Where another employee may say, I'd rather not pay that much premium, and I'd rather put my money away, get a higher deductible, and open up an HSA account. In the private exchange, you have multiple different plan options for that. You also have multiple different provider networks. So each insurance carrier, as you know, has certain providers in and out of their network. So if there's a specialty hospital in your area that you really want to go to, or your employees really want to go to, you don't have to have a whole one size fits all carrier for your employees. You can have multiple different carriers, and then they can choose if that carrier has that hospital in the network. And then it's definitely a way to lower the premium because of the fact that there's not only HMO but PPO, higher deductibles, and then just as you know, different insurance carriers often have different pricing each year, so there's the options of just seeing the competition in the market. One really unique situation that I came across that I just thought was a good case study for how this private exchange really helps lower costs is had a doctor's group with about 32 employees enrolled, and they were with Aetna on a traditional group plan. And on their traditional group plan, they were paying about $25,000 a month. When they moved over to the private exchange, they offered more carriers and more options, and the total premium ended up going down to $15,000 a month, because for the simple reason that the employer offered more choices and the employees were able to choose lower cost plans to fit within their budget. But with this, obviously with lots of choice, we know that we need to help employees with the decision-making process. So built within our private exchange are a variety of decision-making tools. One of them is a filtering tool. So employees can actually go in there and they can filter out the plans. If there's certain carriers they don't want, they can filter that out. If it's certain cost structure that they're looking for, or certain deductible or co-payments, that's all available. They can also use our plan comparison tool before they make their final decision to just do a more in-depth look at each of the benefits. And then of course, as I mentioned with the networks, they can look, there's tools in there for them to actually search for their providers before they make their final decision. And then we actually have Ask Emma, which is our automated enrollment tool, where she will actually talk to the employees as they're going through their enrollment and walk them through step by step, asking them a few basic questions that may help them narrow down the plan choices that they're looking for. So I'm going to just play a video to show you a little bit about how she would interact with the employees during enrollment.
Hi there, I'm Emma, your personal benefits advisor. I'm here to help you learn more about your options and find a health plan that suits you best. Great, let's get started. To help you find a plan that's right for you, I'll need to know a little more about you and your dependents. So for everyone you plan on covering, choose the apple below that best matches their overall physical health. Okay, moving right along. Just type your doctor's name or preferred hospital in this box and click search. When the results come back, select the ones you want and we'll continue. Great, we found them. This is how much you'll pay for your premium each month. This number is a monthly estimate of how much you'll pay for out-of-pocket costs. And when you add it all up, this is an estimate of your total cost. Your premium is how much money you pay each month to have health plan coverage, and this amount is usually deducted from your paycheck by your employer. Congrats! You found a plan!
Okay, so you can see it's very innovative, and it's just real simple, and it helps employees just walk through the process easily. But it's also a common question, is do they have access to a person? And the answer is yes. We have licensed benefit counselors on staff that will speak to your employees and actually walk them through the whole enrollment process and make sure that they choose the plan that best fits their current health scenario. So the next reason would be defined contribution. So let me just get a second while the slide goes. Defined contribution, you may have heard of this. This is a different contribution strategy that many people are moving towards, where you would actually set a defined amount based on your budget so that you're able to have a budget for your health insurance versus an old traditional way where you just do it based on percentages. So again, another quick video on this just to show you how we would build in the rules into the private exchange. There's many ways that you can structure your contribution. You can structure it based on different classes of employees as well. So if you want to contribute more for others in a certain class, we can actually already set it up in the system to automatically do that, and it'll show them their exact amount. So here's a video that kind of runs through that.
So here's a modern-day dilemma. How do you control the rising cost of healthcare while providing high-quality benefits for your employees? Keep paying higher prices every year? That's bad for your bottom line. Start skimping on coverage for your coworkers? And that's bad for morale. But what if you could easily control your company's healthcare costs while providing more personalized coverage options for your employees? Well, now you can. It's called defined contribution. And here's how it works. You decide on a certain dollar amount to give your employees for benefits. It's like an allowance for their insurance. And they use that money to buy the coverage that meets their individual needs. So instead of offering a one-size-fits-all healthcare package, you empower your employees with more freedom to choose the combination of coverage that's just right for them. And you control the overall cost by setting up rules around where the money is spent. For example, let's say you gave your employees a monthly allowance of $350. You could decide that $300 goes towards health insurance and $50 can be used for dental coverage, a vision plan, or other benefits. And if you want to keep offering some plans that are 100% employer paid, like long-term disability or life insurance, that's completely up to you. We make it easy for you to choose where the funds can be spent, and our decision support tools help your employees decide which plans fit best. So why put up with the same old balancing act year after year? Find out how a defined contribution program will change the way you and your employees look at benefits. You control the costs, they decide what works, and we make everything easy. Simple solutions for the complex world of benefits.
Again, just so many ways you can customize it, and we could make it work for you within the technology. The fourth reason, very exciting reason for most firm administrators, or if you're the one mainly responsible for handling the health insurance, is that you don't have to worry about the traditional group renewal process, which for many administrators and HR professionals consumes hours and days of your time, because you're typically hit with a high double-digit rate increase, and then you're trying to make decisions on behalf of the firm if you're going to change carriers, and trying to figure out if that's going to impact people with their doctors, and it's very difficult to do, especially the larger the employer size. So the neat thing about the private exchange is that it's all handled automatically through the portal. And basically all we do every year at renewal is we open back up the portal, and the employees have access to a variety of different carriers on the individual market that they can choose from. So if they want to switch plans, they have that choice, and you don't have to worry about impacting somebody's doctor network. They actually can do that, and they can decide based on the renewal of each carrier what they want to do. So your job is simply just to open up the portal. There's no more paperwork that you have to do, no more scrubbing forms. I don't know, if you've changed insurance carriers, it's a big hassle and process with all the new forms that they require. This is all automated, all electronic enrollments. And again, just like I mentioned before, the licensed benefit counselors are there each renewal to help your employees walk through the whole process. And then just by moving from a group market to the private exchange individual market, we often find that just the rates, even in comparison apples to apples to your current group plans, are more competitive. We've seen that over and over. So our team, initially, if you were wanting some quotes through the private exchange, our team basically takes your current information, your census, and your current plans and rates, and we run everything through our exchange and give you a side-by-side comparison, so that before you roll it out to your employees, you can at least ensure that the rates are competitive. But the interesting thing is, I've done this a number of times, and employers will ask me to show them apples-to-apples comparisons, and which I do, and then they decide to move forward. But when they move forward, the interesting thing is many employees don't choose the plans that the employer originally picked or thought they would choose. And it just shows you that given the choice to the employees is a better way to go. So this is kind of the way that it would look. Just one example, we have a number of different spreadsheets and illustrations that we can show you, but this is just one where we'll just compare 3 plans to what you have, give you your total cost based on the number of employees, and then kind of the average employee-only premium. And we can break it down in more detail however you need it, and help with some models on your contribution to help make sure they're paying similar to what they are now. And the next one, which you've probably already gathered a lot through this, is that this is going to be a lot less administration. Typically on the group side of things, there's a lot of paperwork involved when you hire or terminate an employee. All the changes are done through the portal. So not only do you have it at enrollment or at renewal every year, but it's a system that you can use throughout the year for administrative changes. Some people just use it as a simple enrollment system, but if you want to, the system has the capabilities to be a full HRIS platform where you can load your employee handbook in there. You can do total compensation statements for your employees so they can really see the benefit of the money that you're providing for them towards health insurance. We can put PTO tracking. We have one client right now that wants a full onboarding system. So when they hire a new employee, basically their employer creates the login account, and then all the initial paperwork is out there, the W-9, the I-9s, the W-4s, you know, payroll deduction information, whatever information you need for them to complete on the onboarding process, we can put out there, and it can all be uploaded to the system electronically. As well as compliance. You know, there's a lot of compliance documents that need to be made available to employees, like the ERISA SPD document, and so that's all out there electronically. No more paper involved. So the 7th reason is ancillary benefits. Already customized, built into our exchange, is we have pooled together multiple different people, multiple different associations to have one specially priced discounted benefits for things like dental, vision, life insurance, disability. And unlike if you went on the market today and tried to get ancillary benefits for your firm, we don't have any participation requirements in our portal. All that we need to offer all of the ancillary benefits to all your employees is just 2 people to enroll. And so these are typically benefits that you wouldn't see if you just went out to the market on your own. But if you say, we have some ancillary benefits that we like, and we have some specific carriers that we would like to keep, we can also build them into the portal for you. So it's very customizable. The other thing that we have out there that's really neat is something called Teladoc, and we charge these, it's like $4.95, and employees have access 365 days a year, 24/7, to call a doctor or to do a video chat with a doctor, and for simple things like maybe simple prescription requests, or just a simple call and consultation with the doctor. So it doesn't have to take time away from work to go to a doctor's appointment. So all those are built into the exchange, and we're continually increasing our offerings. And if you have specific products that you would like us to put in there, it's very customizable. The next one is consolidated billing. So when you think about having multiple different carriers and multiple different plan options, that could be one hesitation, is to think, well, how am I going to control the billing for this? And especially if you already have multiple different carriers now, you might get different bills. Through the portal, we can consolidate it all into one place, and there's a lot of reporting features that make it really easy for you payroll deduction reports, any sort of data that you need, we can do that, and it's just one bill. And as a licensed TPA, we can help facilitate different payments. And then we talked about this before, which is consumerism. This is where the market is moving. So most people think that, the traditional option is going to become less and less popular just because of the consumerism push that's been happening in the health insurance market. And then ACA compliance is obviously on a lot of groups' minds. We have in our portal a dashboard where you can actually calculate things like full-time equivalent. If you're on the line between 40 and 50 employees, you're not sure if you're going to have to meet the pay or play employer mandate. The system will calculate your part-time employees and give you the number if you're over 50 or under 50. There's also the affordability requirement that says that a plan has to be 9.5% of the employee's income or less, or else they're eligible to go get a subsidy. And if you're over 50 employees, that could prompt a penalty from the government. And then there's the question a lot of employers ask is, how do I know whether my employees are full-time or not because they're variable hour? Well, there's some tracking mechanisms where we can tell you when the employee actually has to be considered full-time and offered benefits. And then if you're over 50 employees, there's something called 1095 reporting. The system will gather the data needed for that reporting, and we can provide it to who's ever doing the reporting for you. So the technology is great. You won't see this type of technology offered to smaller groups. It's groups of 50 to 100 or more employees, but we're making it available to all of our association members. It's very customizable. It's very user-friendly. So just kind of in summary, and then we'll go to questions. As we went through these 10 reasons, there was a number of ways that I gave you to control your costs. One is just giving the employees choices helps reduce your monthly overall costs. We've seen that. Setting a defined contribution helps you control your budget and know exactly what you're going to spend each month on health insurance. And then we talked about that often just looking at a different market, the private exchange will be less in price than the traditional group plans. And then the time and the money that you will save on renewal processing, new hire paperwork, and all the administration. Okay, well, you see my number and information on the screen there. You can call in and ask to speak to any of our licensed benefits counselors. That's my email directly. I work exclusively with employer groups of usually 10 or more employees, but we have people here that will work with any number of employees that you have, but our minimum size for an employer group would be 5 enrolled employees. So thank you for listening. Thanks for your time.